Do STIs impact female fertility through the uterus? Imagine trying to plant a seed in soil that's inflamed or scarred. That's similar to what happens when sexually transmitted infections affect a woman's reproductive system. Certain infections like chlamydia and gonorrhea can cause inflammation in the uterus, fallopian tubes, cervix, and ovaries. If these infections are not treated early, they can lead to a condition called pelvic inflammatory disease, which is a major cause of infertility in women. Pelvic inflammatory disease causes swelling and scarring inside the upper reproductive organs. This scarring can block the fallopian tubes, making it difficult for eggs to meet sperm or for fertilized eggs to reach the uterus. When the uterine lining becomes inflamed, a condition called endometritis can develop. This inflammation can interfere with the implantation of a fertilized egg or create an environment that's not friendly to pregnancy. In some cases, infections like Trichomonas vaginalis can ascend into the uterus and cause similar issues, although the direct link to infertility is less clear. The main ways STIs impact fertility through the uterus include causing inflammation and scarring that block or damage the fallopian tubes and uterine lining. This damage can prevent conception or lead to pregnancy complications like miscarriage or ectopic pregnancy. If the infection spreads or is left untreated, it can cause ongoing damage that makes it harder to conceive in the future. Some infections, like human papillomavirus, can indirectly affect fertility by causing changes to the cervix or even cervical cancer, which might require treatments that impact fertility. However, these effects are more about the cervix than the uterus itself. The key takeaway is that STIs can cause inflammation, scarring, and damage inside the uterus and fallopian tubes, which can make it harder to get pregnant or carry a pregnancy to term. That's why early detection and treatment of STIs are so important. Regular screening, prompt medical care, and consulting healthcare professionals can help prevent long-term damage and preserve fertility. Remember, everyone's situation is different, so personalized medical advice is always the best course of action.